Welcome. My name is Riham Nassar. I'm a specialist clinical pharmacist. Today we will talk about refeeding syndrome. So let's start our lecture for today. Refeeding syndrome is a medical condition that is characterized by low electrolyte levels and or thiamine deficiency. It occurs when there is a reintroduction of food to someone with persistently inadequate intake. The term food is used here in the general sense since it can also occur with enteral or parenteral nutrition. Refeeding syndrome is a major concern because it can lead to dysfunction of multiple organs, and in severe cases it can lead to organ failure and death. It's for this reason that risk of refeeding syndrome should be considered in the nutrition assessment of all hospitalized patients. The pathophysiology or process that leads to the development of refeeding syndrome is not entirely clear. However, there is agreement in the literature that it's connected to a rapid switch from catabolic to anabolic pathways. When energy intake is low, the body is mostly catabolic, breaking down glycogen, body proteins, and fat to create what it needs to survive. During this process, electrolytes and thiamine are used up and not replaced, leading to deficiency in the cells. Once the patient is fed, energy finally becomes available. The glucose leads to an increase in insulin. Insulin stimulates anabolic pathways. Anabolic pathways use up micronutrients faster than they can be replaced, and micronutrients reach a level of severe deficiency. That deficiency is what causes all the problems. The American Society of Parenteral and Enteral Nutrition has released guidelines for assessing risk of refeeding syndrome. They classify risk as moderate or significant using criteria such as body mass index, recent weight loss, recent intake, electrolyte status, fat and muscle status, and disease state. Patients at significant risk only need to meet one of the criteria such as having a body mass index less than 16 or having minimal to no intake for greater than 7 days. An important consideration when using this tool from Aspen is that risk is likely cumulative, meaning the more criteria that are met, the greater the risk. It's also important to consider that electrolyte can appear to be at normal levels even when electrolyte status is poor and the laboratory testing of thiamine status doesn't appear in the criteria because it's currently unreliable. Thank you for watching.